What is a health condition that causes muscle weakness and skin rashes? Hi everyone, my name is Dr. Erin Carter and I'm a rheumatologist and internal medicine specialist, and this is my series called Rheumatology 101 where I teach you about common rheumatology topics. So the condition I'm talking about specifically is called dermatomyositis. And this is a condition that causes inflammation in muscles, which leads to muscle weakness. Now, the most commonly affected muscles are the proximal muscles, so the muscles closest to the body, such as your upper arms and upper legs. So patients will have difficulties doing things like brushing their hair or getting out of a chair, going upstairs, those types of things. And now in severe cases, other muscle groups can become affected, including the neck muscles, abdominal muscles, and in very severe cases, the swallowing muscles, the muscles around the heart, or the respiratory muscles. Now, besides the muscle weakness, this condition is also associated with some classic skin rashes. And if you're a medical student or resident, please listen up because these come up on exams all the time. And I will share photos below here as I speak so that you can see what these rashes look like. But the first rash is one called a heliotrope rash, which is a purple discoloration around the eyes. Next is shawl sign, which is a reddish rash at the back. And then a V sign, which is a similar rash, but just a V sign on the front. Next is a rash on the hands called Gottron's papules. And there's also another rash on the hands called mechanic's hands, which people can get. Now, this condition can also be associated with other symptoms such as joint pain or swelling. And there are actually a few different subtypes of this condition, things like antisynthetase syndrome or MDA5 dermatomyositis or amyopathic dermatomyositis. And so this is where seeing a specialist can be very helpful. Now, another very important thing about this condition is that it's often associated with an underlying malignancy. So every patient that's diagnosed with dermatomyositis gets a very thorough cancer screen to see if there's any hiding cancers anywhere. Now, treatment with this condition usually starts with steroids to bring down the inflammation as quickly as possible, and then patients are transitioned to other immune-suppressing medications. I hope you found this helpful. If you have any questions, please leave them in the comments, and if you'd like this type of information, make sure you're following along.